What you doing, little man? What you doing? Hello, everyone. I'm doing a Monday live post. I don't usually do Monday live posts, but wanted to kind of bring you behind the scenes a little bit of what we do here at the Wildcat Sanctuary and what you enable us to do. We are joined here with domestic Bengal Tygger. Tygger came to us years ago after he was privately owned, and unfortunately Tygger is an overstimulator and was biting their daughter who had epilepsy really bad. And so Tygger came to us, I can't even count how many years ago, but he's 14 years old now. And he's been really good. He's had a few bits of biting since he's been here at the sanctuary. He currently lives alone, but most recently, Tygger has had some bladder and urinary tract issues. And so right now he's eating so well, so I don't want to disturb him. But at 14 years old, he often usually looks older than his age, and he's been doing really well, but the staff realized that that he was straining to go to the bathroom and nothing was coming out. And any of you that have domestic cats, especially males, know that you can get urinary crystals, which can block the go ahead. Sorry, I'm talking to him, looking at him. That can block going to the bathroom and also get UTIs, especially in male cats. We often don't see that, surprisingly, here at the Wildcat Sanctuary because we feed mostly a raw diet to our Bengals. But, you know, little Tygger here proved us wrong. And so we thought which would be a routine, kind of taking care of it, would be doing antibiotics, right, Tygger? Doing antibiotics, flushing fluids, anti-inflammatories, pain management, and thought that he'd be back in Catio Town in a few days. Well, he's proven us wrong, just like all of our medical mysteries here at the Wildcat Sanctuary. He has undergone intense therapy, which means he's had, this is off now, but he's had an IV catheter. So similar if you brought your cat to the emergency vet, we hospitalized him and did emergency care here for the last 4 or 5 days, which included IV therapy of sub-Q fluids and a catheter, a urinary catheter to help pass his urine. We were able to get the crystals cleared up, the UTI cleared up, but Dr. Campbell has actually been spending the night here every night to make sure that he could express his bladder, Tygger's bladder here every 3 hours, make sure he got fluids. The animal care staff have been watching this little boy like crazy, and it's so good to see he has an appetite. But kind of where we're at now, and if Clark comes back, I'll talk to him, is that we removed his IV catheter. We're going to be removing his urinary catheter, and every time they removed his urinary catheter, we could express his bladder, but he couldn't express it on his own, even with the catheter. And that's really rare. Usually once they have this treatment for crystals and a urinary tract infection and you remove the catheter for the IV and for the urinary tract catheter, that they just start peeing on their own because you've cleared everything up. So we are kind of now at a rock and a hard place, trying to decide if we, if he would have to be hospitalized somewhere else, which we don't think the outcome would be different, if he will just need a little bit longer treatment to be able to learn to go the bathroom on his own again, or if there is something more neurological going on and the UTI and crystals were just a side symptom, meaning if neurologically his bladder can no longer expand and contract for him to release his own bladder. And that might not sound horrible, but it is definitely a critical issue. If cats cannot release their bladder can explode, and they go immediately is is a very, very bad outcome and usually death. And so that's why hospitalization and making sure that we manually express his bladder through the catheter every 3 hours and ultrasound his bladder to make sure it doesn't rupture is super important. And so I wanted to, he's just such a little good guy, and he's got a great appetite and everything, but the problem is we can't manually or mechanically, as we like to say, express his bladder every 3 hours for the rest of his life. So the next few days are going to be critical. With that support, you can see he's doing great. I have never seen him look so good because of the sub-Q fluids and the IV fluids he's been getting. He usually looks like, you have to say, oh, I know. He usually looks like a really old man, like a kidney cat, man. So he's been in this hospital, but today to see him not attached to so many fluids and tubes is great. He's a little mad at me because he wants to come walking around, but the biggest thing is we want to monitor his intake of food. We've put in his litter box paper so that we can see the amount he is going. And I know Clark said today would be a big thing. When I came in here to the hospital, Clark was ordering 2 more kinds of medications. So this is Tygger, if you're joining us. He's a domestic 14-year-old Bengal cat who's been hospitalized in our hospital right now. And so I just have to do a huge thank you to Clark, who left right now. I think he might be going to get meds. I saw him call the pharmacy to try another medication that helps cats constrict the bladder, and hopefully that he can go to the bathroom on his own. So the hardest thing is when cats look healthy, but mechanically their body isn't working. And so now Tigger's over there grooming. So I'm gonna just turn the camera around and say hi to everybody. Hello. So if you're just joining us, I wanted to kind of take you through a day in the life here. Not only do we do big cats, but with Tygger, this little Bengal, to say that our staff has been working around the clock to help this little guy, make sure that we can hopefully save his life, and that he's a medical mystery again, is an understatement. I know Clark has spent maybe 4 or 5 nights getting up every 3 hours, doing the fluid checks, expressing this little guy's bladder, and today he just got his IV catheter and IV fluids removed. So I think he's a happy camper, but he's still going to be in the hospital here. He's got a great appetite, but again, he's not able to urinate on his own without intervention. So the crystals are gone. And so there is some damage that can happen neurologically, but it's usually with cats that have had trauma, cats that have spinal issues like really onset arthritis, hip dysplasia, things like that, and very, very rare in cats, more common in dogs, that allows that muscle to contract. So he's sitting here like a very good patient. Dr. Campbell says he's been a great patient. He's been very tolerant, which is also unusual for Tygger. Tygger is a lover, but Tygger has, Tygger has just a short fuse when he gets his way. And I wanted to kind of just showcase today the amount of work that goes in even to the smallest resident here. I'm gonna shut this real quick for Tygger, and that kind of walk you through the hospital. But it's not just the big cats get that love and medical attention, is it, Tygger? And you can see on both his front paws, I see you have your food somewhere, you're sneezing a little bit, you can see where he was shaved for his catheters. And those catheters have to be changed every couple days. And then obviously he has his urinary catheter too. So he has been patient with us. Clark has been extremely patient and committed. I see he's got just paperwork lined up too with everything he's been doing. Another medical mystery. Clark had said he worked at emergency clinics and did 100 of these a month for older male cats, and that with that treatment, they usually just go back and go home. We do know once older males get crystals and things like that and UTIs, they have a tendency to reoccur over and over. So he's on a special diet as well. So what we don't know right now is going on is that if there's something more neurological, meaning his body is not working with his bladder, or if there's something wrong with the bladder, that means this is why all of this happened, is that it wasn't being fully expressed, and it wasn't until he showed clinical signs of not being able to express at all in the litter box that we noticed this. But I'm so grateful, so extremely grateful for the staff and for Clark, who have put so much time, and you don't even seem to mind at all. Now you can see he's got some runny eyes, but you've been through a lot of stress, some little sneezes. But he's been really good. He's had TV on in here. He's had radio on in here. And then today, I was hoping to get an update from Clark, but he kind of ran out. So we're here in the hospital. It's been probably a little bit since we've been in the hospital. As you guys know, if you're new, are the crystals like kidney stones? No, crystals are small crystals that clog the urethra, so it causes a blockage. They're very, very small and grainy. And so it can really cause a blockage, but if Clark's coming in, I think he would be the better one to explain what's going on for us. He's the medical guy, but we'll see. And we'll go out and see some office cats too. And we'll catch Clark on the way out. Can we catch you? We're live. Let me do this. People are asking the difference between kidney stones and crystals and things like that, and you are much better explaining. Okay. I've also been explaining like how much time you've put in and spent overnights.
Well,
and
he's worth it.
I was going to say, what kind of patient has Tygger been?
Yeah, I don't know where to look, so I'm not used to
it. You can just look at me.
So kidney stones can be made from different types of things that form inside the kidneys themselves. That's not at all what he has going
Correct.
on. His kidneys are fine. There's nothing wrong with them, but we're having some changes in the bladder. And oftentimes with neutered male cats, due to hormonal changes, when we neuter them, it changes the hormones or androgens in their body and how they process and make their urine and digest food, and how those minerals are absorbed and utilized. So what can happen is we can get changes in the bladder that set up an environment for crystals to form. Those crystals are microscopic, but they sort of float around inside there. They make it really irritating, and then they can congeal and then form stones. The urethra of the cat, which is the outflow out the body, is very, very narrow in a male cat. And so it doesn't take a lot of the crystal grit to plug it up and keep them from being able to urinate. It's a huge problem with neutered male cats. At home in emergency, when I did emergency and critical care, I easily treated 10 of these guys a month. For urinary blockages. So it's very common. They show signs of where they're going to the litter box over and over and over and straining and nothing's coming out, or small little drips. They're often vocal, and they get a really full, hard bladder. If you feel up there, it can be really super rock hard and uncomfortable.
And he's been very patient with his treatment, hasn't he?
He's done great. I mean, he's a bit of a caution cat. He's got some pretty good teeth and some hind claws on him that he'll get you, but he's
And what's our next steps, do you think? Or because I see the IV catheter came out. Does he still have?
So today is a huge day for him.
He's got to tell us what his next steps are.
Yeah. So I've been treating him. I did pull a urinary catheter a couple of days ago, and we still had some issues going into the weekend. So I placed another one simply because we don't have a lot of options over the weekend as far as care and things. So. Today was the day he got his urinary catheters out, his IV catheters out. He's getting some medicine to help with the inflammation in the bladder and the urethra, and hopefully he goes and he pees, and it's a good, nice stream of urine. If that isn't the case, there could be some other things that might be going on Probably the biggest one, not to use too much of a fancy term, but it's called an atonic bladder, and that's just a fancy word for the bladder that doesn't want to contract anymore. So it's just a bag of fluid. He wants to try to pee,
but the bladder doesn't respond.
Bladder doesn't respond, so it doesn't squeeze any of the urine out. It just sort of dribbles out really slow. So we're hoping that's not the case.
But we'll keep everybody posted. So I was telling them that you've spent several nights here caring for him around the clock, and he's probably gotten more sleep than you have.
Yeah, every 3 hours.
So, and he was eating good for me. I mean, that eating is not the problem, diet. It's about being able to go to the bathroom on his own. So everybody keep Tygger in your thoughts. If you're new to the Wildcat Sanctuary, he is just in our hospital, hospitalized. This is not where he lives. We have catio town and bungalows, and we'll go see some office cats too. And so this is just temporary, but we need to be able to control his environment so we can control his intake, his outtake, and we can monitor if he is urinating on his own. But it's nice to see him without tubes, and thank you for your commitment to him and to all the residents here. And we're gonna go say hi to some other cats and show some people the other Savannahs and Bengals here, and we will keep everybody posted on little Tygger here.
All right.
If you're just joining us, we were just visiting one of our cats that is in the hospital, and then we'll say hi to Squirrels right here. Squirrels is one of our office cats. If you're new to the Wildcat Sanctuary, not only are we a nonprofit rescue for big cats like tigers and lions and leopards, but we have over 50 small cats. Most of what we specialize in are the Bengals and other hybrids. Let's see if we can find little Kojo right here. Kojo is one of our Highlander hybrids. You can see Kojo is a polydactyl, and he's got ear curl. He is being a little tough guy right now and deciding, he's one of our newer cats here, deciding to test his boundaries with all the domestics he lives with. But he's become a very favorite with everybody here at the sanctuary. And so we do have cats in our office, but if you're new, we'll kind of go do a quick look out the window at Catio Town. We're not going to go all the way there today. We'll say hi to Dahlia. There's Squirrels. We'll say hi to beautiful Dahlia as we go out. What you doing, princess? Squirrels wants to be the center of attention, and I don't want to lose service because usually when I come outside it loses service. But we have, for those that are new, Catio Town. Oops, again. I lose service when I go out, so today we're not going to go out, but you can always visit us at wildcatsanctuary.org as well, because Catio Town is an indoor-outdoor play area for all of our Savannahs and Bengals. It has catios with tons of things to climb, water features, even faux grass and grass boxes, and then inside, it's kind of like a home environment for them. And so if you're new to us, we have cats everywhere. And then definitely stay tuned over the week where you get to see more of the big cats. So we're going to be featuring more of the lions, tigers. You can see as Kojo walks. And of course, no live post is complete without sanctuary dog Kiara, right? Saying hi. But today we really want to kind of really highlight Dr. Campbell, also our other vet, Dr. Camper. Last week was Veterinary Appreciation Week, a Vet Tech Appreciation Week. And so it's amazing not only what our caretakers do for the animals here, but our vet team and our vet techs. Also, if you're new to us, is we are in the office. Not only have we decorated for Halloween, but for those of you that are new, we do have our memorial case here, which features so many of the animals that have left us over the years to their new wildlife, and it's a way we remember every resident. Do you have to go potty? Do you want to go outside? Do you know that I'm working? You don't want to go out? Not without me? Okay. The other thing we have is we've have been doing some Halloween decorating and doing some door decorations. So over the next couple days, you'll probably see it's a contest we're having internally here where people get to decorate their door. Usually we always do it cat themed. But it is just another way for us to blow off steam here at the sanctuary. So again, thank you guys for tuning in today. We will keep you posted on Tygger. It's just one more thing to explain here at the Wildcat Sanctuary, that even the smallest cats touch our heart in the biggest ways. Because of your support, we're able to do everything for the small guys, just like we do the big cats. We're also always able to welcome the next cat. Would you like to go out on your catio? Is that what you're thinking? It's a little chilly out here. So the office cats also have access to their catio. And a lot of people ask us, how do we determine who lives in the office? Well, we first go with the non-peers, because most of the cats that we rescue, the Bengals and Savannahs, are here because they do not use the litter boxes. So that's the first and foremost of when they go to Catio Town or out to one of the bungalow areas. But the rest is about personality and who gets along with who. And it is like housewives of the sanctuary. It is changing all the time who gets along with who. Emery right now has her eye on Kojo and probably not even wanting Kojo in her spot. But we will see more of you guys over the next week, and we will keep you updated. But thank you for allowing us to love the littles just like we love the big guys.